the past, when someone would call 911 for help to handle a serious mental health problem, they'd expect the police to arrive. Now, the city is offering new ways to respond that may not involve law enforcement. Thanks to the city's Community Safety Department, residents can get the right help they need when they need it. Welcome to City Life. I'm Beverly Thompson. Joining me to talk about the work of the department is Ryan Smith, Community Safety Director. We also have with us Abena Badeko. She is one of the clinical managers with the department. Welcome to you both, and thank you so much for joining me today.
Thanks, Beverly.
Thank you.
So Ryan, we touched on it briefly, but tell us generally what the Community Safety Department is, what you do, and why was it even necessary?
Sure. The Community Safety Department was created a year ago. We just celebrated our 1-year birthday.
Congratulations.
Thank you. We were created to reimagine some aspects of how we respond to 911 calls so that we can make sure that we're sending the best response possible to meet people where they're at and respond to their needs. This work was built upon a lot of study of how we, what kinds of reasons people call 911 for, what are the outcomes of those calls. And we found that people call 911 for a whole range of reasons, and not all of those really are about criminal activity or violent crime. People call because they have unmet needs, because they need to be connected to services in our community. And when you look at that and you think that traditionally we've had 3 types of responses. We have police, fire, and EMS. I think what the manager and others saw when we looked at that data is, given the kind of diversity and the wide range of reasons why people call 911, we need to think about additional types of responders that we can bring in who have the right training to respond to things like a mental health crisis, or really the kind of skills that social workers have to help connect people to services in our community to get them the care they need. And so that's the reason that we exist, to do that work, to really develop a 4th kind of response. And again, the spirit of it is to send the right response based on the needs of residents in crisis, and to be an additional part of our public safety team here in Durham.
Gotcha. So are other cities throughout the United States doing any programs similar to this?
Yes. It's an exciting time in our country. Durham, we are the first to do some of this here in North Carolina, but we're not the first in our country. We've had the opportunity to learn from places like Denver and Albuquerque and San Francisco and Portland and other cities who are already today sending unarmed teams of responders for calls that involve mental health crises, for calls that are about persons who may be experiencing homelessness and need help connecting to housing or other types of services. They're showing that this work can be done in ways that help us do an even better job of meeting the needs of our residents, getting them connected to services in ways that are consistent with the safety of everyone involved on the scene.
Okay, thank you. Abena, I know you're a clinical manager.
Yes.
Tell me what it is you do as a clinical manager when you provide the service that Ryan just described.
Absolutely. So one of the things that I do, Beverly, is oversee the clinical management and operations of the department. I also currently lead a community response team. So I provide guidance and leadership out in the field when they actually take live 911 calls. So providing how to interact with our neighbors, how to engage with our community members, as well as how to connect our team and our neighbors to community resources.
Okay. What excited you about this? I mean, everybody knows that this is a new department, but I can imagine some people would have some trepidations about joining a department like this.
I was excited from the very beginning, from last July and even before. This was a vision that I had when I came into Durham and when I started working in my previous role, and seeing the needs of our neighbors and knowing that they need so much and wanting to provide some of that, wanting to help them to heal and bringing my skills and expertise. I just felt like this would be the perfect opportunity to blend everything that I've done over the last 20 years.
Great.
And I'm excited. I'm here.
Great. I know Ryan's happy about
we're
that.
lucky to have Abena and Lee and all of our clinicians, absolutely, and others.
Great.
Yes.
So now tell me about what it is exactly you're doing. I know you call them pilot programs. First of all, why do you call them pilot programs? And then tell me what they are.
Sure. So when we talk about something being a pilot, what we mean is We've done a lot of study and careful planning. So there, we have an understanding of how we think these will work, but pilots mean that we still have important things to learn, and that we're going to learn by doing. We're going to learn in a way in which we're being very transparent about what's working well, what's not working. We're going into it with a lot of humility and in full recognition that we're going to learn some things, and there are some things that we're going to have to change, and we're going to have to refine the model in order to really best meet the needs of residents. So this is a learning period for us. We'll be regularly reporting on how our pilots are performing, what tweaks we need to make in order to have this be the model that we want to expand, or if it's going to be appropriate to expand. So pilot just means we have important things to learn. We have an intentional way of going about that learning, and we're really just so excited to be in that place now.
Great. So Ryan, what exactly went into developing these pilots?
A year of careful planning. We took our first year to do the planning necessary to bring the kind of care and seriousness that this work demands. That had 4 major components. It was a highly collaborative process, and I think it's important for our residents to know that this wasn't just something our small department developed on its own. We were very intentional about building a collaborative planning team that included representatives from police, fire, EMS, 911 center, behavioral health providers, our schools of social work, who we met with regularly over the last year to help develop these plans. It's also a community-informed process. So we had bilingual town halls. We met in community with residents to understand what they hoped for these types of responses, what types of people they wanted to respond to certain types of calls. It was data-driven. We looked a lot at the history of our 911 calls to try to make the most informed decisions about the kinds of calls that are appropriate. And then it was evidence-based. We took full advantage of the opportunity to learn from cities who are a little further out in front of us to understand the kinds of calls they're sending unarmed responders to, what are the outcomes of those calls. All of that went into developing the pilots that we just launched.
That is a lot of work, and like I said, community effort. I mean, this is amazing work. So I know you recently launched 3 new crisis response pilots, and they're intended to connect people to the right care at the right time, like you said. Let's start by looking at the Crisis Call Diversion Pilot. What is that program?
Sure. Crisis Call Diversion embeds a mental health clinician into our 911 call center. So the same place where people call 911 and a call taker answers the phone, we now have mental health clinicians. And that helps us make sure that we can quickly connect. If someone is experiencing a mental health crisis or their loved one, we can quickly connect them with a professional who has experience to help better understand that need, make sure that we're able to send the right response, to make sure that we're able, if we can respond to something remotely, not all calls require an in-person response. Our clinicians in 911 are able to do this. And if a call requires an in-person response, our clinicians are really in there to help further de-escalate the call. So if it's a suicide threat, maybe someone has a weapon in their hand, we'll still send police like we would today. We have clinicians now who can continue to work with a call taker to de-escalate that, make sure the situation is as safe as possible when responders arrive on the scene. So there's a lot of benefits that come from it.
Okay. So Abin, as far as what happens when someone calls 911, what is the process that you go through, and what can the caller expect to happen when they call you?
Sure.
In the 911 center.
So the caller can expect professionalism and appropriate care. So when they call into 911, they will be transferred, particularly probably to our our call center clinician, who right now is Lee Mazer, my counterpart, who will take the call and will provide the care that's needed, whether it is talking to them for as long as they need to feel calm and stable, or to send that call out to crises to the community response teams, or to do a follow-up to our care navigator team. So the caller can expect to receive appropriate level of care and on any level.
So they don't have to ask for anybody. They just call and describe, go through the usual information that the 911 call takers take.
Exactly, Beverly. Like, they don't need to try to figure out who to ask for or what number to dial. They still call 911, and the call takers will send that call to the appropriate level.
Okay, all right.
And can I add, Beverly?
Sure,
so I think one of the nice things is we're fully integrated in 911, and that means residents don't have to learn a new number. They can just, if they're experiencing a crisis, call 911. They don't have to ask for particular types of responses. They just do what they would do today, which is they share what kind of crisis they're experiencing. And because we're integrated in 911, that call will be routed to the appropriate responder. So if it's a clinician in the call center or one of our unarmed response teams, based on the type of need that they have, we'll send the appropriate response.
Wow, that's great. So Ryan, the second pilot actually focuses on the community response teams. What are those?
Our community response teams are 3-person teams, so we're not sending anyone alone, that include a licensed clinician, a peer support specialist, and an EMT. This team will respond in lieu of law enforcement for nonviolent mental health crises, for calls that may involve persons who are unhoused, who need help connecting to housing services, to people who may just have basic unmet needs, so like welfare checks. So those types of calls that are, again, nonviolent, that are really about people with unmet needs and connecting to services, instead of sending law enforcement, we'll send our unarmed response team.
Okay, and Abbott, I know you've been a part of the first unarmed response team. Share with us what that experience has been like for you, and if you can, provide an example of a call, and you don't have to mention any names or anything, but just an example of what happens.
Sure. It's been very thrilling. It's been very exciting and fulfilling to be part of this initiative and to be out there and providing the care to our neighbors. As I've said before, I'm leading the team, and we have a licensed clinician, we have our peer support specialist, and we will have EMT as well. And the team has been going out taking calls, trespassing calls, welfare checks, things like that. And it's just very fulfilling to go out and to see their neighbor's face when we ride up. And we are so unassuming and so very much not like law enforcement, in which they have been used to receiving a call from. To see their faces and to know that we're providing that care. And oftentimes they'll tell us, we're angels from above, oh wow, we didn't expect you, but we're so glad that you showed up. So things like that. We have a wall in our office of like all of the quotes that we've gathered so far over this last few weeks.
Oh my gosh.
And it's just filling. It warms your heart. We recently went to a call in which it was a call that came from a third party. A community member called because it was a home that was empty, and they thought that it may be some sex workers there trespassing. And when we pulled up, indeed it was. And we go in knowing that everyone is human and everyone deserves the same level of care.
That's so good to hear. So Ryan, how many crisis response teams do you have? And then what is the response time like? When someone calls for help, how long does it take for someone to get there?
Yeah, so currently we have one team that's running Monday through Friday, 8 to 5 p.m. We're going to be adding over the summer 2 more teams. When we add our second team, we'll expand to 7 days a week. And then when we add our third team, we'll have a team that's working more in the evening hours. So right now it's one team. Residents can expect that we'll be adding, kind of expanding service and hours over the summer as we have more teams coming on. In the second part of your question, can you remind me?
Oh, the response time.
Yeah. So our goal has been to respond in under 30 minutes. And that goal was set because when you look at mobile crisis response teams, which we have in our community, their goal is to respond in under 2 hours. So we're being able to get to calls faster. And these are, again, kind of lower acuity, nonviolent calls. But what we're seeing is much faster than that. So I think we have, I think, consistently seen under 10 minutes that we're getting to calls, sometimes under 5 minutes, and Abena can talk a lot more on the front lines. And one thing that I'm sure we'll come back to is we're going to make all that data of our response time will be transparent and on our website. We're working on finalizing that, but by August, residents can come and kind of continue to track how we're doing on response time and other things they care about.
That was great. Transparency, yeah. So I know the third pilot is on Care Navigation. Tell us a little bit about that program, what it involves.
Care Navigation is about follow-up care. It is in recognition that in a moment of crisis, there's only so much you can do sometimes to really to really help a resident get connected to the care that they need and want. And that follow-up care is really important, and it's often one of the areas that we've underinvested in. So Care Navigation specifically has a goal of where our teams identify there's a need and benefit from follow-up, to follow up within 48 hours of an initial encounter with our team, and to potentially follow up repeatedly, not long-term, but for a couple of months, to help get people connected up to the community-based care that they want and need.
How do you follow up? Is it by phone, or is it in person, or just depends?
It depends on the situation. So we will follow up in a phone-based way if that's appropriate and works for the individual. I imagine that most of the follow-up will be in person, and it's certainly built to be an in-person type of follow-up where that's needed and necessary. And always, again, when we send people into the community, it would be in teams of 2 for follow-up.
Gotcha. So Abena, what can a resident who is receiving follow-up care actually expect to see?
The same level of care as someone receiving that initial response from the community response teams. Same professionalism, same skilled individuals coming out and being able to connect with them and provide that resource.
Okay, all right.
Can I add a little bit there?
Sure you
So I'm
can.
So I do think, we talk a lot about the values that we bring to crisis response work. And so we talk about, I think residents can also expect that our team will come with a trauma-informed approach, that will come, and Abena can talk more about what these things mean, with a commitment to harm reduction. We'll come meeting people where they're at. We'll come in a non-judgmental way, like regardless of what it is you're struggling with, there's no judgment. We're here to meet you where you're at, to understand the types of care that you think that you need and are ready for, and to help you get there, really as a partner and as just providing compassionate care. I just wanted to add that too. And
well, thank you. I appreciate that. That was really helpful in understanding, just the foundation of your work, I think, so people understand what they're actually getting. So I do know that in addition to the 3 pilots you described, you are launching a co-response pilot later on.
Yes.
So tell me about that pilot.
Yeah, so co-response, all these things fit together, right? It's from the moment someone calls 911 all the way through to follow-up care, making sure we're able to provide the right response. Co-response adds to that holistic care, and it's making sure we can send the right response regardless of the potential risk posed by the situation. So some calls that involve a mental health crisis may pose a potential greater risk, for example, if a weapon is present. So when a weapon is present, we won't send an unarmed team, we'll send law enforcement, but we will pair them because it will help us best serve the needs in that moment with a licensed clinician.
Okay.
So a licensed clinician paired with a CIT trained officer to respond in moments where there's still a behavioral health crisis, but there are some other factors where there's violence towards others, where there's a weapon present, where law enforcement has an important role to play, but so too do clinicians. So they'll respond as a team. The clinicians will still be in our department. It'll be a joint response between community safety and the Durham Police Department.
So for all intents and purposes, a resident who's calling really doesn't need to know about all of these particular pilots. They just need to ask for what they need, right?
That's right. They don't need to change anything they were doing. They can call the same number. They just need to share what has led them and prompted them to call 911 and know that the system will do its very best to send that call. And I say its very best because these are pilots and we have limited staffing capacity. We are not running citywide yet for our community response teams, and residents can always check online to see our updated service area map.
Okay.
We're not running 24/7 yet. This year is about learning how to do this work well, beginning to do a better job of making sure that we're sending the right response and meeting residents' needs. And as we figure out how to do this work well, and as we demonstrate that this model is really helping us do an even better job, then we'll hopefully be able to grow those resources and make sure that regardless of whenever a resident calls 911, we'll have these services available. This year is a year of learning, and so yes, residents should call. They should share what their concern is to 911. They should know that we'll send the very best option we have available in that moment to meet their need. And that may not always be one of our community response teams.
Okay. So Abena, how will people know when someone from your team has arrived? I see that gorgeous shirt you have on there. So I know that's your new logo. And tell us a bit about that.
It is. So when we arrive, our teams will not be wearing a traditional uniform. They will be wearing this t-shirt with our logo, the heart symbol, which we also have on our vehicles.
Okay.
So when we pull up, it unassuming car with the logo, so it immediately lowers any type of stress, anxiety, anything like that. And then we come in with these shirts. So anytime a community resident sees anyone with this green shirt and this
Says it
logo,
all.
then they know this person is representing them via the community safety department.
Okay, responding from the heart. I love
Yes.
it. So
Yes.
Ryan, I said that, but tell me what heart means.
Yes, I'm glad you asked, Beverly. So there's
I
a
don't
long
think I could
story.
have gotten through the show without
I'll
you
try to make
explaining
it.
Okay.
I'll try to make it short and sweet.
Okay.
So,
All right.
when we were starting this work, we were doing a lot of ride-alongs with officers. We were trying to go to the kind of calls that we thought we might ultimately send unarmed responders to. And on one of these calls, one of our team members was riding along with an officer, and it was a mom who called about her son who was experiencing a behavioral health crisis. And during the course of that, one of our team members was talking with the mom while she was, those are difficult calls to make,
yeah, I
so
can
hard.
imagine.
Mother was understandably very concerned about her son. And our team member was really able to play an important role of empathy because this team member had a shared lived experience of a family member who had had similar types of mental health crises where law enforcement had been called. And the mother looked at her during this call and said, "So you have a heart for this." And it was not just that, but kind of everything that followed of the mom who had a loved one in crisis, knowing that there was someone there who understood at least a little bit what that was like, could really connect with her, that helped establish better trust in the moment, that helped in ways that are intangible but felt very real about kind of a better outcome to that call. And after that, we wrote on our wall that quote, "So you have a heart for it." It has been on our wall for probably 8 months straight.
I've seen
And it
your
has
wall.
it's been very interesting to see how that comes up again and again. Like when we're interviewing amazing clinicians or peer support specialists, it is so common when we ask them why you want to do this, they'll say, "I just really have a heart for it." Or when we're doing reference checks, it's like, yeah, that person, you know what? They just really have a heart for crisis response work. And, I think it signifies the kind of compassionate care that we want to provide. Each of the words really seems to resonate. This is holistic, it's empathetic, it's about assisting people in the moment of crisis. So for all those reasons and others I could go into, it has just been a phrase and a word that has just lived with us. It continues to pop up in different ways, and we felt that it really spoke to and captured the spirit and intention of this work. So that's why we chose it.
Wonderful. Great choice.
Yeah.
Great choice. So Ryan, is the goal for these pilots to operate 24/7 eventually? And by the time they won't be pilots, I guess.
Once we're out of the pilot phase, which means that we have kind of demonstrated that these models are helping us do an even better job of serving the needs of our residents, then yes, the goal would be to provide them 24/7, because if these are in fact helping us better meet the needs of residents, then we want them to be available and reliable just like any other essential crisis response, which is no matter when you experience it, you can trust that we're going to be able to send the response that best matches the needs of residents.
So this question's for both of you. What do you hope this program actually accomplishes? And then what are some of the indicators of success that you're going to be looking for?
Guess I'll go first.
Sure.
I will that this program fills the need in our community that is open right now. I will that our community residents and our members and our neighbors know that we're here for them, that we truly do have a heart for this work, and we show up because we want to show up. I will that this is a ripple in North Carolina and it spreads to every other city in this state and in this country, that their cities can also do all 4 programs and do it well. So I will that we are a beacon of hope for those that need a little bit.
So Ryan, can you top that?
I can't top that, but I'll add my own. So I would say, and I want to hear from residents that are receiving our services that felt like we sent the right response. And they felt that we were able to help them get to the care that they needed, that we're able to demonstrate that and show that we're connecting people to care. I want our other first responders to see value in this and say, you know what, I want more teams like that. I think that this is helping us. It's helping us, all of us, do a better job at meeting our shared goals of public safety. And I want the result of this to be that it's also saving officers time, that they can focus in other areas, that we're able to divert calls that can be handled by the responders to our compassionate care teams. And a lot of this stuff is the kind of stuff that we'll also be tracking and reporting on in our monthly dashboard.
So I was going to ask then, how can residents stay informed about your work as well as get other information about what your department is doing?
Yeah, well, we're committed to full transparency here. So starting in August, we'll be putting out a monthly dashboard. It's going to allow residents to understand how many calls we're responding to, what are the outcomes of those calls, how many calls we're eligible that we didn't get to, how many times did we have to radio for police backup, and a whole bunch of other stuff. So that'll be available starting in August. They can go to our website at, I think it's now durhamnc.gov/heart is the short. But we're committed to sharing a lot of information there. We're also committed to continuing to be in community, listening to residents, understanding their experiences about this work and how we can continue to do it better.
You make me proud to call Durham home. This is just amazing, and I'm proud to work for the city, actually. So this is just amazing work, and I'm sure we're the model, the beacon, as you said, for many other cities across the nation.
Well, thank you, Beverly. That means a lot, and we are also just super grateful for all the people who have made this possible.
All right. Thank you for joining us, and hopefully you can come back again. Give us an update.
Thank you.
All right.
Thank you.
Thank you. Well, that does it for City Life. Don't forget to follow us on social media, watch us on the Durham Television Network and on YouTube. And now you can listen to our podcast on iTunes. I'm Beverly Thompson. Thank you for joining me to learn more about city life in Durham.